All right, so today I will be discussing the differences between Medicare and Medicaid in the state of Indiana. So, Medicaid is state by state, and Medicare is national, which means that Medicaid, the state dictates a lot of the different laws that go into it, as well as the on a national level. Whereas Medicare is the same across the board in terms of state by state. Medicare is a joint federal and state helping people with limited income. Going over the beneficiaries, Medicare helps people that are ages 65 and older, whereas people that are younger than 65 have to have certain disabilities to qualify for this, and some of those things could be lateral sclerosis and people with ESRD. Whereas to qualify for Medicaid, the federal law requires states to cover certain groups that provide them flexibility to cover others. The eligibility groups would be elderly people, former foster care children, infants and children under the age of 19, low-income parents or caretaker relatives, newborns, people with disabilities or blindness, pregnant women. And then for a lot of these groups, individuals must meet certain incomes and resource limits. Individuals must meet state and federal requirements for state residency and U.S. citizenship. Going into the covered services in Medicare and Medicaid. Medicare covers they help cover inpatient hospital care, SNF care, hospice care, home health care, whereas the Part B would cover doctors and other provided services, outpatient care, home health care, ambulance services, DME, many preventative services, whereas Medicaid also helps cover doctor visits, inpatient and outpatient hospital services, mental health services, prescription drugs, prenatal care and maternity care, preventative care like immunizations, mammograms, and colonoscopies. States may cover other services, and it depends on state to state. It would be dental services, home and community-based services, physical therapy, prosthetic devices, vision and glasses. Children and adolescents get vision, dental, and hearing and other services through Medicaid earlier on. So I covered who was covered, beneficiaries, discussed what the scope of the program is national, and what is covered. So that should be about it for Medicare and Medicaid.